When somebody does come along to our information sessions, which I'll be showing you in a moment across the county, each person will be given a booklet which gives all the information about what is dementia. That is a map. That is the way that we tend to disseminate a lot of our information and give the dates of when we're coming to a town where you are.
This part of the brain is the creative side of the brain. So the evidence shows, and certainly my experience has shown me, that people with dementia can actually, if stimulated, if motivated, can actually become more creative, which means that they can develop and grow. Because so often we hear this story of dementia being a very destructive process. It's all about separation and loss. And here's some evidence and some real practical experience that shows actually it can also be very much about growth and development. It's my personal belief that it's all of our personal responsibilities to create as many creative opportunities for people with dementia as we can. It's also my personal belief that we should be as creative as we can, because the more creative things you do, the more creative you become. So the easier it is to be creative with other people. And this opens up the opportunities. We start to learn that language of creativity that perhaps with advanced dementia, sometimes when the speech can become affected, people can still sing. They will always retain the ability to sing even when they can't find the words to speak. So if we can be a bit creative about how we communicate, then actually we can continue to grow and be alongside those people with dementia right the way through our journeys together.
Cornwall was very proactive before the national strategy. There was a lot of really good work that was happening, but what that national strategy did was it brought to fore dementia, and it was a policy driver that meant that actually executives, bigwigs, PCT boards, people that make decisions actually couldn't dismiss dementia anymore. We had to do something about it. The complexities of dementia means that we can't just package it up and sort one bit of the system. We can't just get it right in GP practices or just focus on care homes or just focus on hospital. It's complex because it covers the whole of health and social care system. It engages with many, many different people, many different organisations. The statutory services, the specialist services, so need to be there to support those people who need their specialist input. But dementia shouldn't just fit within the remit of the mental health providers, because that then puts that load on mental health providers, and all of us over here say, that's fantastic. Ooh, that's a tricky one to solve. That's your bag. I don't have to get involved. Whereas actually if we package dementia up as a long-term condition, it is all of our business as a person, as an individual, in our communities, in our role as being a health and social care worker. And that's a huge culture change. And I think that actually the third sector, volunteers, have an awful lot to bring to the table, as long as they are supported, trained, supervised, as long as their quality assurance models in place, and as long as the voluntary sector isn't used instead of the specialist services. I think there needs to be a balance, but being very realistic, our capacity to support people to live well with dementia relies on us thinking differently and shifting our culture and looking to other organisations to work with. There's lots of really good work going on within services. There's lots of new organisations that have joined us working in dementia. And I think that's really key to ensure we try to expand those to support those services. That there are designated people who have nominated to be dementia link workers, to bang the gong, to rattle cages, to be supported to get updated with training, to go out and continue bringing home that message that dementia is life-changing, but actually we need to do something about it. We can't do anything about it as individuals. We need to work together. Some of you are probably really well hooked into your communities, either through your community networks, Some of you probably volunteer, some of you go to memory cafes. I think one of the solutions to working with dementia is actually empowering local communities to look after the people that live and work there. And something as challenging as the financial climate means that actually, well, the council and the PCT, the primary care trust, have to work more closely together.
Dr. Bolton, is it true that by eating a lot of beetroot, this diminishes the likelihood of developing dementia?
That's what happens after 5 o'clock on a Friday night when you have problems with the person you're caring for.
Who are you directing?
There are no helplines whatsoever. You get an answering machine.
What does acute mean when you say acute environment?
Over the last few months, my husband and I have had quite a bit of experience with all the various, or a lot of the various organisations that are represented today. My father's had just very recently to go into a care home, and we know there's an awful lot of help out there. We think that there's probably a new stage of help available for him, which we know nothing about, and we thought to come along today was a good opportunity. Really, really good. Far more help available than we realised before. It wouldn't have made us change our decision. It was the right decision for my father to go into a nursing home. But there's an awful lot of help out there, perhaps for people who weren't in quite such a tricky situation as we were, and so could latch into all this help. So an occasion like this is tremendous for people like me to get to learn information, but the networking and the linking that's going on between the organisations is just amazing. I think the number of people here and the amount of enthusiasm speaks for how well it's gone. It's been a tremendous day. Incredibly well organised too. I think it's been really, really successful. I especially like the offer that if we can't answer your question right now, we'll find someone who can and we'll get back to you. That's really important. You don't leave here sort of left up in the air or what's happening. So it's been a really, really worthwhile day.
Well, we came here today because of what the library service can offer the public. We try and work well in the community, that's part of our remit, and we have lots of things on offer for the public, for dementia sufferers themselves, for the carers, for people in the care homes, and everybody that's related in any way. We have the books on prescriptions that you can borrow for free, lots of books on dementia and treatment, beautiful books on books to share, pictures to share, where you can sit down on a one-to-one basis and look at the pictures, talk about the pictures, and then sort of say, can you remember this? And it's a lovely icebreaker. We also have the performing arts side here as well, which we have CDs and DVDs, and we also have music for the care homes to borrow, for good knees up in a sing-song. And Carolyn and I go around to Travana, the care home, once a month, and we have a bit of story time, a bit of music. I dance with some of the ladies there. We have an hour around there with our friends, and it's brilliant. And because of that, I've taken an interest on the dementia side, and I've been very lucky that the library service has backed me on this to go out and talk to the public on what we can offer people. So then it's lovely to come and meet everybody else. I mean, I sat and listened to the speakers this morning, lots of interesting facts and figures I didn't know, and where to go and what to do, and then walking around the hall this afternoon again talking to people. And it's all right talking to people on the phone, but when you meet them face to face and actually see what they have on offer, and then you can take that back, and then we can signpost people at the library where to go. I think it's gone very well. Lots of people here this morning, everybody talking to everybody else, and going around with all the stores, a lot of interest with everybody, and the public are taking a great interest in asking questions. So I think well done.
Well, I came today because I wanted to find out whether there were more resources and where I could get more knowledge of supporting people with dementia, because that's what I do. I take daycare, and I want to specialise in dementia care because I feel it's such a poor acknowledgement out there of any resources that are available.
My reason for being here, I have a father with dementia, an elderly, both my parents are in their 80s, and I'm just struggling to find out what there is out there that we can access, and I can't even remember, which is worrying, how I came across this, but I got myself booked on, and it has just been so informative, and I'm so glad I came. Well, I'm certainly going away with an awful lot of information, which will probably take me at least a week to get through, but yes, I've learned an awful lot, and hopefully we'll be able to implement a lot of it within my family.
I've learned that there's a lot of different people doing different things, and I just feel really the communication of all these resources should be enlightened more, whether through the press or the papers, I don't know really, perhaps the surgeries, nurses departments, hospitals. I just think we need to put more information out there for carers.
I'm so impressed with you know, all the different organisations that are here, the people like yourselves that actually put this on and drew everything together. I mean, there's obviously been a tremendous amount of work going on behind the scenes, and it's been very, very worthwhile. And I hope that you do this on a regular basis, because information is changing on a regular basis.
And I feel as soon as I walk through the door, the welcome. Not immaterial whether you're actually personally involved or not. I felt the actual approach and the actual availability at each stand. Everybody is so willing to talk, to discuss things, to enlighten you on new things, new ideas, and I felt it's been excellent.
I think that my main reason for coming today was to really try and get across to the general public that dementia doesn't have to be something to be scared of. You mention the word dementia and people run a mile. They either think it's catching or they can't cope with it. But by getting it across in what I call a simple form, no clinical words used, easy to understand, I think this is what people want. Brilliant. A good day.